Hey YouTube, this is me, Passion One, coming to you. It's been a while since I've done a update, and no excuses. I'm just gonna tell you what's going on with me as of today. Um, I do have a surgery date for my breast cancer. It's going to be October the 25th. And I did get approved for immediate reconstruction, and it's called a tram flap. I don't know if I said before, it's a procedure where they take your own tissue and reconstruct the breast with. So that's what I'm having done. I may be in a hospital for 3 or 4 days. It just depends on how it goes. It's a very extensive surgery. From what they told me, the first surgeon, the general surgeon, is going to come in and he's going to start the mastectomy at 1 o'clock. And then the plastic surgeon will come in around 2 and 2:30, and he'll start with the abdomen and do the donor tissue for the breast. So the surgery will take anywhere from 4 to 6 hours, give or take, and it's scheduled for 1 p.m. But I have to be at the hospital at 10:30 because they say it's a lot of prep to get ready. When I actually went to see the plastic surgeon, he did my measurements. I guess he was trying to see what did I qualify for. If I qualify for a tram flap or what do you call it? Or the like the silicone implants. And because I have the lap band, I did not want any other foreign objects like inside of me. And when you get the silicone implants, they put an expander in, and you go back every so often, however he deems necessary, to get your expanders filled with normal saline. And then when you've reached the desired cup size, you go back into surgery, have the expanders removed, and then you have the actual silicone uh, implants put in. And then after they heal, you go back and have another surgery to have your areola and your nipple done. But that's a lot of surgery. So with mine, I may have a total of 3. I have the first initial surgery, and then I'll go back and I'll have another surgery to do the left side to get some symmetry. I don't know if that's just going to be like a lift, because he told me that uh, the right side where I'm having the mastectomy will be smaller than the left side. So he'll do another surgery to give me some symmetry, which is fine with me. And then I'll have to do, another surgery to have like the areola and the nipple done. Um, I was also told that I definitely will have to have chemo. Um, and that's for a couple of reasons. Uh, the type of cancer I have is a very aggressive cancer, and even though there has not been any cancer seen anywhere else in the breast, cancer cells, from what I'm understanding, can travel through your bloodstream. So, 2 reasons while I'll have to do the chemotherapy. That's one, and the second one is they're gonna do the thing where they take out some lymph nodes, or they'll inject the dye and check the lymph nodes. And he was saying he'll remove some at level 1 and level 2 to make sure that there's no cancer in there. But whether they are or not, even if there was some cancer in them, he would not want to remove all of my lymph nodes under my arms, because then I would have a problem for the rest of my life with extreme swelling in my right arm. So if there's traces of cancer left, we'll do the chemotherapy, and that'll get all the cancer out of my bloodstream and everything. I don't know exactly when I'm going to start the chemotherapy or anything like that, but I just know that's something I'm going to have to do. So I may just go ahead and shave my hair off before surgery. I mean, I wear a lot of wigs and stuff anyway. You can't see now. My natural hair has grown enough that I could slick it back, and I put this little afro puff on it. That's how I've been wearing it, and it looks so cute. I mean, just where I got it, where I want it, and now I'm gonna have to cut it off, but it's okay. It'll grow back. It'll grow back. But that's pretty much what's been going on. We're not gonna really even discuss how much I weigh. I last got on the scale and I was 189. And I had got down as far as 174. But I've been using stress as an excuse. But I have 3 weeks before my surgery. And my thing now is I have to prepare my body for this surgery, because the better my body is before I go in, the more quickly and the better I heal. My protein intake is very essential, because I don't know if you guys know, but protein is very, very important when it comes to wound healing. So I will definitely be getting in my proteins, whether it's through my main source is going to be through fish and seafood, but I will do my protein shakes. It's really important to me to exercise, not just because it can help me lose weight, but because I'm going to be immobile for a good little while after I have the surgery. So I want to start out walking the treadmill, or just do what I can do now to just to get this stuff popping up on my computer, and I'm trying to get it off so I can finish doing what I'm doing with you. Okay, anyway, so please excuse me. Hold on. Well, I'll just leave it anyway. So, and then another thing is it's very important for me to do stuff like make sure I have a good fluid intake. I have really, 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 really bad veins. So I'm going to have to drink an excess amount of water every day, because I want to be able to have good vein access, and I want to have enough fluids in my body so that when I get that anesthesia and those pain medicines and stuff, I have enough fluid in my body to help flush it out. Another thing that I was going to be doing, let's see, I said the water. Oh, sometimes we take like herbal vitamins or herbal substances. I'm not going to do any of that. I will just do my my green leafy vegetables, my seafood, when I mean like shrimp or fish or salmon, something like that. And it was told to me that drinking lemon water like after surgery will help my swelling go down tremendously. So I will be doing that. I actually have a recipe. I've gotten in touch with a website called Tummy Talk. It's a wonderful site. It's for people that are having any type of plastic surgery, and when you go on there, they give you so much information. So I've been getting information from there. I bought a wonderful book. I'll show it the next post I do. That's giving me a lot of information about breast cancer and things that you might not know that you need to know. Like, just FYI, I did not know that the difference between radiation and chemotherapy. Radiation is done with an X-ray. Chemotherapy is done with medications, but radiation is localized. It just does that one area, whether it's the breast, the prostate, or whatever. Where chemotherapy is what they call systemic, and the medication goes through your veins and it covers your whole body. So I mean, I'm an LPN, but I'm not a specialist, and I don't work with on a cancer unit, so I did not know that. So that was very interesting for me to know. So I will just give you guys an update as I come along, and how everything's going, and as I get closer to my date, I want to film this whole entire journey. Maybe I'll do once a week until the surgery, take you in the morning before the surgery and right after the surgery and stuff like that. But I just want you guys to stick with me, and I'll try to show as much as I can throughout this journey. So thank you, and you have a blessed day. If there are any new weight loss journeys out there for the month of October, please let me know so I can get in on the bandwagon. Other than that, I'll just be doing my own thing. Thank you, and stay blessed.